And he said, that will not happen here. So now for 8 years, those CEOs have still been at the table after 8 years. And I have to say that the effect has been phenomenal. We don't have to go into an organization and try to talk this up the chain of command, communicate it make sense, make it through all the cultural filters in that organization. It goes this way from the Institute and it permeates down all over the state. The effect there has just been incredible for that. This is what we learned from Don Berwick about it. Don said that the enemy is disease and it's error and it's waste and it's not each other. And I think that's what we're beginning to learn in the state. Is you can have all the proprietary interests that you want, but when, at the end of the day, the enemy is not each other. So our approach has been to tell the truth about the performance of our healthcare system. That's been tough. The first time I made a speech about that, I got hauled off the stage by one of our CEOs that had a consortium and said, you can't speak so frankly about this kind of thing in the state. I had to say, I can't not do it. Because we have to start surfacing these issues, talking about our own performance and telling the truth to ourselves and to everybody else that'll listen about it. It's the only way. We want to blame no one, but hold ourselves accountable for changing this system. Galvanizing the entire state to work together on it, providing strong leadership. Those are the principles, the inclusion and cooperation. Everybody's included. All of our committee meetings are open to anybody that wants to be involved. Our budgets lay out on the table for anybody to see. Every dime that we've ever gotten at the Institute is posted on our website. You can see who gave it to us, how much they gave, what initiative that it went toward, and when they gave it. It's all there for everybody to see because we don't make any laws. We don't sign any contracts. We don't control anybody's behavior. The only way that we can direct this state is through the power of a vision of a future that we'll face if we work together versus the one that we'll face if we work alone. We think the collective vision of cooperation is far more compelling than that one of isolation. So place this work in its rightful context. We think it's virtually the foundation. It's not about technology at all. It's about this being the enabler of all the other things that we want to do for transformation. Mobilizing as many parts of this system as we can, the stakeholders, the payment system, legislation, the entire pot of money available to us. We've brought in, I don't know, about 11, 12, 13 million dollars in contributions over the course of the last 4 years to get this work going when we didn't really have a pot, so to speak, at the beginning. But there's just been something about that compelling vision that's brought the money in for it. This is all on the website. Here are some of our results. Our qualified EMR adoption rates at 36.4. That's well ahead of the nation. 100% of our community health centers are in some stage of EMR adoption. 100%. We're so proud of them. We do not have a digital divide going on in Rhode Island. We outfitted our free clinic first. Whenever we got one of our big rich clinics was putting in one of their electronic medical records, I called them up and said, by the way, why don't you throw in the free clinic in your deal? And they did. The EMR vendor threw it in for free. Then we started getting our community health centers wired. And we ranked #1 in the nation for use of HIT and medication safety in hospitals. We're first in the nation to implement end-to-end electronic prescribing. We ranked #2 in the nation, and for the last 4 years, we've ranked in the top 2 in the nation for electronic prescribing. We have only one more pharmacy to enable before we're 100% electronically enabled in Rhode Island. And Child Magazine in 2006 ranked Rhode Island as the safest place in the nation to raise a child. One of the things that they cited in that was the electronic prescribing system. So we got our $5 million contract, and there's a whole bunch of things on there. Just long-term funding strategy, all that, probably not important right now, but lots and lots of things happening. We passed our law. I mentioned to you that it's voluntary participation. Consumers can see who's looked at their records. There's a notification of any breach of security, strong data security procedures, stiff penalties, and oversight, which was kind of interesting because at one meeting, those darn open public meetings, I was up there flailing away again, like spitting all over the mic, all enthusiastic and talking about what we were going to do. And Maria Montanaro from our Thunder Miss Community Health Center raised her hand and said, hey, with all due respect, who do you think you are? And I said, huh? And she said, no, I mean, seriously, you're just some not-for-profit that sprouted up and all good-hearted and all that, and you're just going to collect up everybody's sensitive information in the state? I mean, who do you think you are? And I was sees her, I couldn't believe that she said that, but she had a point. So we wrote it into the legislation that the state of Rhode Island regulates us. We're not a governmental agency, but we should be regulated because we are collecting up sensitive health information from everybody, and somebody ought to make sure that we're keeping it private and we're following our goals. I mean, she said, Laura, you're a nice woman and all that, but you could get hit by a bus next week. Who's going to come in after you? What, you're going to sell the data to Pfizer? I mean, you've got a big pool of data here. Somebody gets a diagnosis of breast cancer, and next week they're getting flyers from the funeral home because you can make money doing that sort of thing. I mean, there was a lot of concern about that information. So oversight by the Department of Health. Everybody's involved. It's so exciting. It's permeated the state now. It's considered one of the shining stars. Rhode Island has a slew of bad statistics. We have some really terrible stuff going on in terms of unemployment, loss of businesses, loss of coverage for our children in healthcare. We have lots and lots of things going wrong, but not this. This is one of the things that I think is a beacon of hope for us, and it's really been exciting. Now, how they lead in Rhode Island, behavioral health, substance abuse leaders come in. They sit on our board of directors at the highest level of governance. Our key board committee that runs the entire oversight of the whole health information exchange is run by Rich LeClaire of Gateway Healthcare, our behavioral health, one of our behavioral health leaders on the board. He oversees the whole kit and caboodle. Active leadership on the Policy and Legal Committee, strong participation in the Consumer Advisory Committee, and creative input into our stimulus funding application, because one of the things we realized that when we get ready to apply for this stimulus funding, there's money for health information exchange. That's where we can get money for you this time through, because what we're going to write into ours is the ability for them to put in an aggregator of behavioral health EMRs. You need an aggregator that sits in the center of your community and links up all the people that you can talk to, different EHRs that are behavioral health EHRs, not on the primary care side, behavioral health. We're going to write the payment of that into our HIE. That's Rich LeClaire's leadership that made that happen. If you want to know where your nationwide health information network, where your local health information exchange is happening, check this website. And so I think I've written, no, I think you can Google it on there, NHIN Watch, and that will tell you where in the country your health information exchange is located. I would urge you to get involved. We need you very much. And so the last thing I would just say about health information exchange is I was interested in talking with Stephen a little earlier. We both spent time in New Orleans, and I was Vice President for Patient Services at Chalmette General Hospital down in the parish, for those of you that are from New Orleans. And this is a picture of Chalmette General after Katrina, and that is Lake Pontchartrain that you see behind there that you shouldn't see. And we had two campuses. My office was in the other campus, and I'd like to show you the other campus, except it's just a concrete slab. That hospital was absolutely and utterly destroyed, and so were all the patient records in that hospital, gone forever. People that were on cancer chemotherapeutics, people that were on sort of treatment regimes, patterns that required continuity, lost forever in one fell swoop. And I think that it was Secretary Mike Leavitt that said, there may not have been an experience that demonstrates for me or my country more powerfully the need for electronic health records than Katrina. So in summary, I think this is one of the most important transformational elements. Talk about a tsunami. If we can get ahead of this one, if we can tap this one, if we can harness it and pull it into our organizations, is it going to be difficult to do the transformation and expensive? You bet it is. But we can find creative ways to make it happen, especially if you link up with others in your community who share that vision. It affords tremendous opportunity for people who will embrace it for transformational leadership. And it undergirds every major healthcare reform. This isn't going away. This one's not one that'll disappear into the sunset. Might be one of the greatest transformational forces in the history of care delivery. And behavioral health and substance abuse treatment will benefit, but only if you make your voices heard. I would just finish up lastly by saying that